Hello, I'm United States Senator Scott Brown. On Thursday, the Supreme Court upheld the Patient Protection and Affordable Care Act. Regardless of its constitutionality, this heavy-handed, one-size-fits-all health care law is not right for Massachusetts or our nation. Listen, we all want affordable health care for our fellow citizens. In Massachusetts, we have our own health reforms, which I supported as a state senator. And we proved that we can solve the problem of the uninsured at the state level without raising taxes, cutting care to our seniors, or issuing new debt. Prior to passage of the national law, insurance companies in Massachusetts were already prohibited from turning away patients with pre-existing conditions. And young people, up to the age of 25, could already stay on their parents' health care plans. Individuals and businesses had many choices. And we did it without raising taxes on our small businesses or promising growth industries. All of that changed with the federal law, which delivers no substantial additional benefits to Massachusetts. Just higher costs, higher taxes, more regulations, fewer choices, and $2.6 trillion in new spending. The law is bad for jobs, especially in Massachusetts. It raises 18 new taxes, including the job-killing tax on more than the 400 medical device companies in our state and its thousands of employees. Senior citizens are bracing for more than $500 billion in Medicare cuts that were used to offset the law's massive increase in federal spending. We need to remember that our founding fathers purposefully limited the powers of the federal government. They understood that centralizing too much power in a national capital would grow the distance between the people and their elected officials, reduce accountability, and lead to abuses of power. The health care law shows how right they were. Procedural tricks were used to pass the law on a party line vote in the face of oppositions from a majority of Americans. Now, bureaucrats in Washington, as well as the unelected members of the Independent Payment Advisory Board, will make key decisions about your and our health care. That's what happens when we try to force heavy-handed Washington solutions on problems that require flexible, creative approaches undertaken at the state level. The health care bill should be repealed. And we must preserve the right of states to develop and implement health care solutions that meet the unique needs of local citizens, as we were able to do in Massachusetts. Thank you.